Health officials know many of the medical reasons for infant mortality, but why so many African American infants die is a bit of a mystery. But more and more, the reasons are pointing to implicit bias as an underlying cause of so many tiny lives lost. They are tiny yet mighty. These little fighters work every day to survive their premature births. Sometimes they make it, sometimes they don't, especially if the baby is African American.
We don't know of any biological reason for this. We don't know of any socioeconomic reason for this. So it really points us in the direction of asking, what is it that needs to change?
Many now believe a contributing factor to the alarming rate of infant mortality among African American babies is racial bias. New numbers released by Cradle Cincinnati last week show 17 out of every 1,000 black babies don't make it.
I remember feeling like you just made an assumption about who I am when I walked through the door.
Dr. Meredith Shockley-Smith is Community Strategies Director for Cradle Cincinnati. She's also a mother who says she's had more experiences of racism than she can count.
So there's always these millions of questions about how we got there and what they were doing and what I was doing and why I wasn't doing it the right way. And I just remember thinking, are we gonna get to why we came? Like, does it matter that my child is sick?
Leaders at Cradle Cincinnati and other local medical organizations are joining the growing chorus of voices that say implicit bias in the healthcare setting needs to be looked at further as a reason why more black infants die before their first birthdays.
Implicit bias is the negative cultural stereotype that can influence the way that a healthcare provider processes information about the patient.
Dr. Roosevelt Walker is an OBGYN with TriHealth. He's also president of the Cincinnati Medical Association, which advocates for minority doctors and patients in town.
One of the things that patients will report is that they were not taken seriously by the provider and that their complaints may be dismissed.
Dr. Elizabeth Kelly is co-founder of Cradle Cincinnati. The nonprofit is paying attention to the growing evidence and believes training can make a difference.
If we uncover the bias that they have, that they may not know they have, that actually it can change the way that they approach and treat people.
The goal is for this mom and her family to feel supported and to have a safe and healthy pregnancy.
Training started this year.
We are going through, as a first step, a series of implicit bias trainings with hundreds of prenatal care providers.
My name is Dr. Nicole Avant.
Dr. Nicole Avant is a consultant hired to work for a year with Cradle Cincinnati and major groups like UC Health, TriHealth, and the Cincinnati Health Department on implicit bias.
It's not assuming your patient is lazy or uneducated or they don't care about their health. It's like checking those biases at the door. It's watching your first thoughts with your patients. It's slowing your brain down to really interpret what you're seeing.
The training is designed so that it's informative, not judgmental.
We use a lot of active learning, a lot of activities where it forces you to see your own biases. I'm not telling you, you've identified it for yourself.
Both UC and TriHealth hospitals will examine their leadership structures with Dr. Avant to answer the question, are they inclusive enough?
There aren't a whole lot of African American OBGYNs.
In fact, only 2.7% of doctors in Cincinnati are African American. Avant and others who've done research on the relationship between implicit bias and infant mortality know changing attitudes is difficult.
Because if you just put out disparities, people will say, well, if they would only make better choices, if they would only eat better, if they would only exercise more.
But if it saves tiny lives, it's worth a try.
We want to have a robust conversation around this, but just because it's hard doesn't mean that we shouldn't be doing it.
The high rate of black infant mortality is not only happening here in Cincinnati, it's a national issue for large urban populations. You can check our stories from other families who have been through this on the WCPO app on your favorite streaming device like Roku or Fire TV.